What if the secret to finally getting rid of athlete's foot and softening stubborn calluses is already sitting in your pantry? We've seen people tolerate itching, cracking, embarrassment, and costly creams, when a simple, low-cost routine centered on apple cider vinegar can make a real difference for many. In the next few minutes, we'll show you how ACV, apple cider vinegar, works, a safe step-by-step soak you can try, helpful backup remedies, and the prevention habits that keep feet healthy long-term. Check the description for a printable version of the soak ratios and a full demo link if you want visuals. Feet are under constant stress. Warm, damp socks, friction from shoes, and long hours on hard surfaces. Those conditions invite fungi to thrive and encourage the skin to thicken where it rubs. What becomes athlete's foot and calluses? The good news is that these problems respond well to steady, simple care. Reduce moisture, change the skin environment, and restore healthy softness. Apple cider vinegar helps by making the surface of the skin less welcoming to fungus, and by gently softening thickened patches. Here's the ACV protocol we use as the central, hidden secret. Prepare a foot soak using a safe dilution. Mix 1 part apple cider vinegar with 2 to 3 parts warm water. For example, 1 cup ACV to 2 or 3 cups warm water, or 1 part to 2-3 parts in any basin that comfortably fits your feet. Soak for 10 to 20 minutes. After soaking, gently pat your feet dry, not rubbing, and allow them to air for a few minutes before putting on clean, dry socks. Start with daily soaks for the first week, then shift to every other day as you see improvement. Expect to notice reduced itching and softer skin within days, with more significant change over several weeks when you're consistent. Before you try the full soak, do a quick patch test. Mix a small amount of the diluted solution and apply a little to an inconspicuous area, like the inner forearm or behind the ear. Wait a few hours and check for redness, burning, or unusual irritation. If your skin tolerates it, proceed with the foot soak. Do not use apple cider vinegar on open cuts, sores, or broken skin. If you experience severe stinging, blistering, or worsening symptoms, stop and consult a healthcare professional. ACV is best used as part of a routine, not a one-off miracle. Here are supporting natural helpers and how to use them safely alongside the vinegar soak. First, tea tree oil is a widely used topical antifungal. Always dilute essential oils. Add 2 to 3 drops of tea tree oil to 1 teaspoon of a carrier oil, such as coconut or olive oil, and apply as a spot treatment to affected areas once or twice a day. Perform a patch test before use. Never put undiluted tea tree oil on the skin. Baking soda is great at absorbing moisture and neutralizing odor. For a simple treatment, add 1 to 2 tablespoons of baking soda to a small basin of warm water and soak for 10 to 15 minutes, or sprinkle a bit of baking soda inside shoes and socks to keep them drier between uses. Baking soda can also be made into a paste for gentle exfoliation of calloused spots. Apply, rub lightly, rinse, and moisturize. For tougher calluses, a salt or Epsom salt soak before exfoliating helps soften thickened skin. Add about a half cup to 1 cup of Epsom salt or coarse sea salt to a foot tub of warm water and soak for 10 to 20 minutes. After soaking, gently use a pumice stone or foot file to remove softened layers. Do this gently and stop if the skin becomes raw. Finish by rinsing and applying coconut oil to moisturize and form a protective barrier. Coconut oil also has mild antimicrobial properties. Garlic has strong antifungal components, but carries a higher risk of irritating or burning the skin when used raw. If you choose garlic, prefer garlic-infused oil preparations or a very dilute topical extract, and always patch test first. Avoid applying crushed raw garlic directly to the skin for extended periods. A few practical hygiene and prevention habits dramatically reduce recurrence. Dry your feet thoroughly after bathing. Fungus loves moisture. Change socks daily or more often if your feet sweat. Choose breathable shoes and rotate them so each pair has time to air out. Consider sprinkling a little baking soda inside shoes to absorb moisture. Use cotton or moisture-wicking socks and consider breathable insoles. If you use public pools or locker rooms, wear flip-flops to reduce exposure. When you do remove calloused skin, follow with moisturizer to prevent cracks and new callus formation. Safety first. Do not apply any of these remedies to open wounds, bleeding areas, or severe skin damage. If you have diabetes, poor circulation, or numbness in your feet, check with a healthcare provider before trying home treatments. See a doctor promptly if the infection spreads. If you develop severe pain, persistent redness, swelling, pus, fever, or if the problem doesn't improve after a few weeks despite treatment. Realistic expectations. Many people notice relief from itching and smell within days, and softer skin and smaller calluses over a few weeks of consistent care. Fungal infections can be stubborn. If symptoms return, medical antifungal treatments may be needed in addition to home care. Think of apple cider vinegar as a powerful, low-cost tool in an integrated routine. Effective for many, but not a guaranteed cure for every case. To recap, the hidden secret is apple cider vinegar, diluted in a 1.2 or 1.3 ratio with warm water, soaked for 10 to 20 minutes, with drying and moisturizing steps afterward. Complement with diluted tea tree oil for spots, baking soda for moisture control, salt or Epsom soaks to soften calluses, coconut oil to protect, and cautious use of garlic-derived products only after patch testing. Keep feet dry, rotate and air out shoes, and seek medical advice if you have diabetes or if the infection is severe or persistent. If this video helped you, make sure to subscribe to the channel, like the video, and share it with friends or family who could benefit. Thanks for watching, and I'll see you in the next video.